Hi there, it's Dr. Leroy, and welcome to my show, Health, Humor, and Harmony. So, what do award-winning actors Michael J. Fox and Alan Alda, boxing legend Muhammad Ali, 11-time Grammy Award-winning singer Linda Ronstadt, and former U.S. Attorney General Janet Reno all have in common? They were all diagnosed with the same chronic neurodegenerative disorder. April is National Parkinson's Awareness Month, and today's show will be dedicated to this brain disease that affects over 10 million people worldwide and costs about $52 billion in the United States alone, including treatment, lost income, and Social Security payments. And why April? Because it is the birth month of Dr. James Parkinson, the London physician who first described the illness and published an essay on the shaking palsy back in 1817. So, what is Parkinson's disease and what causes it? According to the National Institute on Aging, Parkinson's disease is a chronic neurologic disease that leads to problems with movement and behavior. It is progressive, which means that symptoms slowly worsen over time. Nearly 60,000 people in the United States are diagnosed with this condition every year, affecting men one and a half times more frequently than women. So, what causes Parkinson's disease? It occurs when nerve cells in the basal ganglia, which is a region of the brain that controls movement, become impaired or die. These nerve cells, or neurons, produce an important neurotransmitter called dopamine. By the way, in episode 13, the show about Selena Gomez, social media addiction, and the brain's reward pathway, I discussed dopamine. So when these dopaminergic neurons malfunction or die, Parkinson's disease develops. Scientists still don't know what causes these brain cells to die. So, what are the clinical manifestations of Parkinson's disease? Bradykinesia, or slowness of movement, is one of the cardinal symptoms of Parkinson's. Bradykinesia must be accompanied by either tremor or rigidity in order for a Parkinson's diagnosis to be made. Stiffness and impaired balance or coordination are also common symptoms. Other movement symptoms described by the Parkinson's Foundation include shuffling gait, soft speech, cramping, freezing, or masked face. Parkinson's disease is also associated with non-motor symptoms, such as mood disorders like depression or anxiety, cognitive changes impairing memory and language, constipation, sexual problems, and sleep disorders. It's important to remember that the experience of living with Parkinson's disease is unique to each individual. So, how is Parkinson's disease treated? While there is no cure, the combination of medications, surgical procedures, and other therapies can relieve symptoms. Carbidopa-levodopa, or Sinemet, is a medicine that stimulates dopamine production. Pramipexole, or Mirapex, and ropinirole, or Requip, mimic the effects of dopamine in the brain. Amantadine is an antiviral drug that reduces involuntary movements, and benztropine, or Cogentin, can reduce tremors and muscle rigidity. Surgical procedures, such as deep brain stimulation, or DBS, may help people who don't respond well to medications. In DBS, electrodes are surgically implanted into the brain and connected to a small electrical device that's implanted in the chest near the collarbone. The device and electrodes painlessly send electrical impulses to the brain in a way that can reduce movement-related Parkinson's symptoms such as tremor, dyskinesia, and rigidity. If you'd like more information about Parkinson's disease, check out the National Institute of Neurological Disorders and Stroke, or NINDS, the National Institute of Aging, the Parkinson's Foundation, the Michael J. Fox Foundation, and many other excellent resources. There are also many ways to get involved. You can participate on Moving Day Walk, donate to, or volunteer with any number of wonderful Parkinson's disease charities. Well, that's all for today. Be sure to tune in Wednesday, 3 p.m. Eastern, when I'll be discussing National Infertility Week, which is actually next week. It will also be 4/20, April 20th, or National Weed Day. And here's a joke to get you ready. What do you call a TV show about physicists who smoke pot? The Big Bong Theory. Subscribe to my YouTube channel for more wonderful health content and jokes. And be sure to follow my Instagram at Health Humor Harmony, Dr. Roy. Be well. I'll see you soon.